Welcome to the deep dive. You shared some really fascinating material with us today.
It looked like a really timely topic.
Definitely. We're diving deep into something that, well, it feels more relevant now than ever. Public health, specifically the role of AI in public health surveillance, monitoring community health trends.
That's right. And our job, really, is to unpack the sources you've given us, all the articles, research your notes, and pull out the key insights. The surprising bits, too.
Kind of a shortcut so you, our listener, can get up to speed on how AI is changing the game for understanding population health.
Exactly. Because it's about more than just counting cases, isn't it?
Yeah, it's about seeing that whole picture, sometimes before it fully emerges.
Precisely. Public health surveillance, at its core, is that systematic collection, analysis, interpretation, and then getting that health data out there.
Right, the dissemination part.
Yeah. The whole goal is to inform action, improve health for everyone. And what the sources really show is how AI is said to, well, seriously boost this whole process, make it much more proactive.
Okay, let's get into that. One area the sources really highlight is getting ahead of things, spotting trouble before diagnoses are even confirmed. How does AI actually help there?
Okay, so this is where syndromic surveillance comes into play. It's a key concept.
Syndromic surveillance, right.
So instead of waiting for, say, official lab results, you're looking for patterns. Patterns in less specific data that might signal some things up.
Like a sudden spike in people buying cough medicine in one town. Or maybe searching online for certain symptoms.
Exactly, that kind of thing. Or clusters of people reporting similar, maybe vague symptoms to their doctors or clinics. The sources really emphasize AI's power here.
How so?
Through real-time analysis and data mining of health records, but also integrating other data sources, AI can rapidly identify common exposures among patients who might be part of an emerging outbreak.
So it's connecting dots faster, dots a person might miss or take much longer to see.
That's the key. It sifts through these massive, often messy data sets and finds links that human analysts, might take days or even weeks to uncover.
So it's taking info from maybe different clinics, different systems, and looking for those subtle, unusual patterns. Essentially screening for potential diseases.
Yes, that's a great way to put it. The sources talk about using health records and other integrated data through what they call multimodal learning.
Multimodal, meaning?
Just learning from different types of data at the same time. Text, numbers, maybe even images eventually. AI uses all this to pick up those faint signals. And that capability is just crucial for early outbreak detection, spotting the smoke before the fire really takes hold.
That early warning is huge. But AI isn't just about reacting faster, is it? Can it help look further ahead, sort of predict things?
It definitely helps with epidemic forecasting, using models to predict how diseases might spread. But the sources also highlight a really practical potential application, one that became a major headache recently: vaccination deployment.
Oh, absolutely. The logistics around COVID vaccinations were complex.
Weren't they just? The sources specifically mention how having interoperable health record systems that can talk to each other based on standards, and then enhancing them with AI, well, that could significantly speed up vaccination campaigns.
And maybe cut down on costs or the sheer workload.
Exactly. That lack of smooth data sharing, of interoperability, was a big roadblock during the pandemic. It made coordinating everything much, much harder. AI could help bridge those gaps.
It's interesting how it links early warnings with planning for those big logistical responses. But, okay, for AI to do any of this amazing stuff, it needs data. Lots of it, I assume.
Oh, absolutely. Data is the fuel.
Health records are obviously key. But what else are these AI systems looking at, according to the sources you shared?
Yeah, health records are foundational. But the sources stress that AI algorithms can pull in and analyze a surprisingly wide range of data. They mentioned social media posts.
Okay, I can see that. Sentiment analysis, keyword tracking.
Right. Also news articles, public health data sets, the more traditional stuff, and even satellite imagery.
Wait, satellite imagery? Really? How does that connect to public health trends?
It sounds surprising, I know. But it points towards getting that broader picture beyond just clinical data.
So what could satellites show? Like environmental factors, maybe?
Could be. Things like population density changes, maybe monitoring environmental conditions linked to certain diseases, or even tracking infrastructure development or disruption in remote areas. Things that affect health risks.
Huh. So the goal is to get this really holistic view, finding trends or needs you'd miss just by looking at who walks into a clinic.
Exactly. It's about understanding the community context.
And that kind of broad understanding must be incredibly useful when you have limited resources, right?
Yeah.
deciding where to focus efforts.
Absolutely. That leads straight into population health risk stratification. AI is really good at this.
Risk stratification, meaning identifying who's most at risk.
Yes. By analyzing these huge data sets, AI can pinpoint which individuals or which groups within a population are most likely to benefit from certain interventions, getting ahead of problems.
And the sources suggest this analysis gets quite detailed, not just broad categories.
Very detailed. The material mentions analyzing medical history, lifestyle factors, even genetic predispositions, all to predict, say, the likely future course of chronic illnesses or flag individuals at high risk due to a complex mix of factors.
So instead of just a general public health campaign, this lets agencies figure out who most needs help and where they are to allocate resources more effectively.
That's precisely the goal highlighted in the sources. It makes interventions more targeted, more impactful, and hopefully promotes better health equity too.
And that connects to planning for bigger crises as well.
Definitely. AI is also used in pandemic resource planning and modeling systems.
How does that work in practice?
Well, these systems use AI models to simulate how a disease might spread. Based on that simulation, they can predict the demand for critical things like hospital beds, ICU capacity, ventilators, maybe weeks or even months out.
Wow. So it shifts decision-making from just reacting in the moment to actual data-driven planning ahead of time.
That's the idea. It could be the difference between a healthcare system being completely overwhelmed versus managing a crisis effectively. It allows for much more informed decisions on resource allocation and what interventions to use and when.
Okay, the potential sounds enormous. Early warnings, targeted help, better planning, but actually putting these complex AI systems into practice, especially in really diverse places like India, which the sources mention, there must be some big hurdles.
Oh, for sure. The sources are quite clear about the challenges. A really fundamental one is just data quality and availability.
Garbage in, garbage out, basically.
Pretty much. AI models need good food. Comprehensive, accurate, standardized data. Just getting that, pulling it together from different places is a massive undertaking.
And I imagine basic infrastructure plays a role too.
Definitely. Infrastructure limitations are a major barrier, especially in rural or less developed areas. Reliable internet, enough computing power. That's not always a given.
Makes sense. And for a place with so many languages like India.
That's another specific challenge mentioned. Language diversity.
Yeah.
The AI systems need to handle multiple languages accurately for both collecting data and analyzing it properly across the whole population. Otherwise, you miss people or misunderstand the data.
Okay, so data quality, infrastructure, language, and then the really big one when you talk about health data, privacy.
Absolutely. Data privacy and security are huge concerns, and the sources dedicate significant attention to this. They even use a specific example discussing systems like ABHA in India to clarify some crucial points about how data can, and perhaps more importantly, cannot be used.
Okay, what are those key points? This feels really important.
Super important. The sources state very clearly, only the individual can share their own health records and only after giving explicit consent. Control stays with the person.
That seems fundamental.
It is. Now, they do say that anonymous records can potentially be used by the government, but strictly for things like policymaking, public interest interventions, like identifying those population-level trends we talked about.
Okay, but there's a catch, right? You mentioned how it cannot be used.
Yes, a very significant condition. This use of anonymized data is only allowed after specific protocols for anonymization and aggregation are defined. And critically, these protocols need to be developed through consultations with stakeholders, patients, doctors, the public.
So it's not automatic. There have to be agreed upon rules first.
Exactly. And the sources explicitly state that until those protocols are formally defined and agreed upon, the records are not intended for this kind of government use. It really underscores the tension. How do you get population insights without compromising individual privacy? It requires very careful, transparent processes.
That nuance is vital. It's not a data free-for-all, even for the greater good, until those safeguards are properly built and agreed upon.
Precisely. And related to that are other ethical considerations mentioned, like ensuring transparency in how the AI algorithms work and avoiding algorithmic bias.
Bias, meaning the AI could accidentally make health disparities worse?
That's the risk. If the data used to train the AI reflects existing biases, the AI might perpetuate or even amplify them. Ensuring fairness is critical. And finally, the sources note the regulatory landscape often struggles to keep up with how fast the technology is moving. Laws and guidelines need to evolve.
So it's a powerful toolkit, this AI for public health. It offers incredible ways to monitor health, prevent crises, target help, but it's definitely not plug and play. Making it work effectively and ethically means tackling these really significant challenges around data, infrastructure, privacy, bias, all those things you just laid out from the sources.
That really sums it up. The potential is there for AI to massively augment human capabilities, to give public health officials better tools, deeper insights,
Leading to more informed decisions, faster action.
and ultimately the goal is healthier communities for everyone. It's a powerful vision of technology impacting the well-being of entire populations, not just individuals.
This deep dive has really brought that vision and its complexities into focus. AI's potential in public health surveillance is clear, faster outbreak warnings, smarter resource allocation, a richer understanding of community health from all sorts of data.
But it's equally clear, as the sources emphasize, that realizing this promise means carefully, thoughtfully addressing those big challenges. Data quality, infrastructure access, and especially data privacy and the ethical use of personal health information, always prioritizing consent and fairness.
So as you, our listener, think about health in your own community, maybe consider this. We're looking at a future where technology could make public health much more informed, much more agile. The promise is a healthier society for all of us. What might that evolution look like where you live? And how can understanding these possibilities and the hurdles help us all better prepare for the health challenges ahead?